Well, they're giving me a lot of help with my medication, a discount, which helps me a whole lot because I am a senior citizen retired and I am now 81 years old and I live off a fixed income and that helps me a whole lot.
My husband is a liver transplant patient, and he not only is he a liver transplant patient, he has multiple health problems. But we were with a drug company that every time it felt like that I needed a prescription, I had to go through this formulary exception thing. They would deny it, and then I'd have to go back and do it again. And it was so frustrating. I felt like I would scream because he's on 25, more than 25, but he gets 25 medications daily. Senior PharmAssist was a lifesaver to me. They set up the appointment with me and told me to bring all my medications. And of course, that's a bucket full. And they put it in a computer for me, every single drug. And of course, the object of that was to see if they could find a drug company for me that we wouldn't have to go through so many hoops. And I got them all. That's what was so astounding about the thing. I mean, I felt like the world had lifted off my shoulders. And what topped to me that off, well, it was a little icing on the cake, is that they helped me. And for many months, I was not able to even to buy my medicine because I couldn't afford it. And but because of his condition and his qualifications, they gave me a card that I could get my medicines for $2. And that's been such a tremendous blessing.
Medication therapy management, in my own words, I guess, is working with participants and sitting down and going through their medicines and making sure that they're using them appropriately, that they're effective, that they can afford them. It's also an additional step in working with their providers to making sure that what their providers are prescribing is appropriate. Important is that, as we all know, the number of people over 65 is only going to continue increasing, and as people get older, there are changes in their body that makes it the way they handle medicines and process those medicines different.
Oh yeah, they helps when I go down, they checks my they said bring your medications. I takes my medication and they look and say, you know what this for? Yes, you know what this for? High blood pressure, stomach pain, help prevent another stroke. You know, they checks my medication with me, which helps me to keep abreast of what I'm taking.
I feel like that they put you in touch with what you're really taking, or the person you brought in or helping. They've helped my mom, my aunt understand their medicine. They've helped them identify it and know when to take it and why they're taking it. And it's opened up communication within the family and among the doctors and among the pharmacy out in the drugstores.
What we try to be is a doorway to other services, programs, and resources in the community that someone just may not know about and may not have other connections who can help get them there. So what we try to do is just, do a general assessment of what are your basic needs and try to connect them with those things. We do have relationships in the community with social workers in doctors' offices, other social service agencies. So often we may make a call on that person's behalf and just say, hey, we're going to refer such and such to you. If it's someone that we know can actually reach out and do some follow-up, we'll ask them to do that whenever they can. But we do just like to be that doorway to other services that can help people stay healthy, safe, and independent.
And they gave me addresses and phone numbers to call for food, and they gave me the opportunity to have someone to, if I get disabled where I can't maybe handle myself like bath or fixing breakfast, they gave me a number to call.
First of all, I felt like I might be humiliated. You know, that sounds terrible, but there's a stigma that goes with asking for help. You know, you feel like perhaps, but I've never had such kindness, and I never felt 1 ounce of that, not 1 ounce of that from Senior PharmAssist. And there's no reason why anybody should hesitate to call upon Senior PharmAssist. Not any. There's no, as I said, there's no stigma feeling. You walk in feeling like a human, you leave feeling like one.
It's just a wonderful thing, and I hope it never stops.